Hello and welcome to KGW News at 5 o'clock. Our top story, the Delta variant is sweeping through Oregon and 40% of the state isn't vaccinated against the virus.
Over the past month, we've seen COVID cases and hospitalizations rise. Oregon healthcare systems are pleading with people to help them out, to flatten the curve again. In fact, one sent out an email to patients calling for action right away. Morgan Romero joins us now. And Morgan, you got this email.
I did, Dan. I'm an OHSU patient, and they sent all their patients an email over the weekend with this subject line: OHSU calls for urgent action as hospitals fill with COVID patients. The healthcare system cited its latest very grim COVID-19 forecast. It predicts Oregon will be short 400 to 500 hospital beds. Let that sink in. By Labor Day in just a few weeks, if we don't stop the virus from spreading right now. That means all types of patients wouldn't be able to get treated in the hospital. I talked to OHSU about why they sent out that letter.
It is so sad because it's 100% preventable.
Most people don't see what Jamie Pinney sees every day in OHSU's COVID ICU.
So we're seeing way younger patients, some with no pre-existing conditions.
Stressed healthcare systems now dealing with a rapid uptick in COVID-19 patients. The way things are going, it's only going to get worse.
It is bad.
Data shows Oregon will be short hundreds of staffed hospital beds in 3 weeks.
The rapid increase of who needs my skill set as an intensivist is unheard of. We haven't seen that.
Right now, OHSU is at full capacity based on staffing abilities.
We are not able to provide a bed assignment in the time we wish we could and what we were able before COVID.
As of Monday, 30 people were hospitalized with COVID at OHSU, and COVID patients make up 25% of ICU patients.
It's not normal to have one disease take care of a quarter of your patient population in an ICU.
OHSU says 100% of COVID patients in its ICUs are unvaccinated.
I'm really tired, but all of my colleagues are tired.
Those on the front lines are burned out, breaking down in the hallways and quitting.
Like, I personally started having panic attacks and I'm doing my best to keep it together for my children at home.
What does this mean for you and your family? If you need to go to the hospital for any reason, you may not get a bed. To be clear, that's everyone, not just COVID patients. To make room, OHSU has to delay many types of surgeries, many of which were put on hold this past year.
Anything which is emergent and life-saving right now, we continue to provide that service. We will continue to do our best, but we need your help.
There are things we can do right now to help. Wear a mask inside and outside if you can't keep your distance. Limit get-togethers and get vaccinated.
Absolutely the best defense strategy we have. We can only control now and the future, so do it now.
All we're trying to do is save people. That's all I'm doing by doing this interview, is trying to save people.
If you're not vaccinated, healthcare workers ask you to stay home and avoid being around people. They're also asking everyone hold off on risky activities that could send you to the hospital or the ER. Oregon, by the way, is in a tough spot compared to the rest of the country. OHSU said last week we have the fewest number of available hospital beds per capita in the country.
It's a real concern. Morgan, thank you so much. Some hospitals in Oregon are getting swamped with COVID patients on top of their normal patients. This is Asante, Three Rivers Medical Center in Grants Pass. It stopped all elective surgeries and got emergency approval to then expand its hospital beds from 125 to 161. They thought they would help, which they did, but they still do not have enough room. The CEO and a top surgeon, they're pleading with the community to get vaccinated. Josephine County has one of the lowest vaccination rates in the state of Oregon.
I would describe this as a healthcare crisis at this point. I've been in healthcare leadership roles for over 25 years, and I've never experienced anything like this.
If we do not do this, I guarantee you, you will see refrigerated trucks at the back of the ER taking the bodies out, because that is where we're going to be in the next week or two.
In the next week or two. The hospital CEO said he is not able to shift patients anywhere else because the others are mostly full as well. Just in, the Oregon Health Authority has now approved a third dose of a COVID vaccine for people with compromised immune systems. The FDA approved a third shot last week for immunocompromised people. But over the weekend, most providers in Oregon were unable to give them out because they hadn't had clearance from the Oregon Health Authority. But today, the OHA says healthcare providers will be able to administer that third dose for people with specific conditions affecting their immune system.
There's a new push in Washington for Governor Jay Inslee to require teachers get vaccinated, just like he's requiring some state employees. Washington's superintendent of schools says it's necessary to make sure schools stay open this fall. He says allowing for regular testing, which is what is happening in California, is too risky.
For those folks who are frustrated by mask requirements or vaccine requirements, they need to understand the consequences of a variant like Delta impacting us as it is clearly doing in parts of the country with devastating impacts. We will have to shut down schools.
Governor Inslee's office says it's looking at ways to increase vaccination rates, but has nothing to announce about expanding the mandate list right now. Seattle Public Schools aren't waiting. They're requiring all non-union staff to get the COVID vaccine in order to return to work. They're also bargaining with unions to get a mandate for all staff.
This weekend, the Portland Timbers play their first game since the statewide mask mandate was reinstated. But some fans are a bit concerned about the venue's COVID protocols. Here's Christelle Kumwe to explain.
Victoria Cummings has been a Timbers season ticket holder for 11 years.
That's one of the biggest games of the year, is our rivalry with the Sounders.
But instead of being here at Providence Park to watch the big game Sunday, she stayed home.
It's painful, but I feel that this is a stand I have to take.
A stand against the latest COVID protocols at the stadium. People over 5 have to wear face coverings in all areas other than their seats.
That the seating is arranged so that you're shoulder to shoulder with another person.
Cummings feels uneasy about that with the Delta variant swiftly spreading in Oregon.
We yell, we scream, we chant, we sing. We're very vocal when we're there. So there's a lot of particles flying around in the air, and some of them are going to be filled with that variant.
Instead of selling her ticket, she left her seat empty as a statement. On social media, several others echoed the same concerns, some calling for the venue to require proof of vaccination.
It would be nice to show proof of vaccination, but if everyone wore a mask, that would be a simple answer to helping stop the spread.
But not everyone is concerned about safety protocols. Thousands lined up at Providence Park Sunday to watch the Portland Timbers take on the Seattle Sounders.
I think it's fine. It's not a problem.
Not as much since we're outside, but I think if everyone's taking the right measures, we should be fine.
Tom came to the game, but agrees more needs to be done.
It was cool when masks were the thing to do, but now it's vaccinations. We'll keep our mask on the entire time. We're lucky we have a high seat way up in the back. There's nobody behind us, and so we're in a pretty good shape.
Cummings will keep taking his stand by not stepping foot in Providence Park until masks are required at all times.
It seems to me, with the rapid increase in cases that we're seeing every day in the hospital, that it's time for us to be responsible as citizens and adults to start wearing our masks again to take care of one another.
Christelle Kumwe, KGW News.
Fewer kids are immunized against some serious diseases in Washington right now, and that's because vaccination rates dropped last year. Immunizations in 2020 dropped modestly with younger age kids, but the big drop-off was in 11 and 12-year-olds. That includes an 11% decrease in Tdap, which covers tetanus, diphtheria, and whooping cough, from about 60% to 49%, and an 8.8% drop in meningococcal vaccinations. Health officials blame stay-at-home orders and fears of going to medical offices last year for that drop. They say vaccination rates are trending back up now, but there's still a ways to go to catch up.
So we're really concerned in seeing this decrease in childhood vaccination rates, knowing that means we're leaving our youngest citizens vulnerable to some of the diseases that we know vaccines prevent against.
Roberts hopes parents will get their kids in and up to date on vaccinations before the school year starts up.